Old parents ill in bed or with Alzheimer's disease. They feel shame and frustration when their diapers are changed. Old parents, mentally and physically fragile, are more susceptible to depression and suicidal impulse. But you can't overlook the risks of a secondary infection just because of that. For the elderly looked after at home and in nursing homes, PAROOS Urine Detector. Instant detection of a wet diaper with the press of a button. Now meet our urine detector. It makes old parents, their family, and caregivers all happy. How to use PAROOS Urine Detector. PAROOS is a portable urine detector that tells you if the diaper is wet or dry without taking off clothes. With no electromagnetic waves, you can safely use it. It checks if the diaper is wet enough. To put the detector as close to the diaper as possible, place it right on top of clothing and press gently to remove the space between the clothing and the diaper. A green LED lights up when the diaper is dry. A red LED lights up when the diaper is wet. Based on the wet diaper area, you can choose to change the diaper. Choose between P100, P200, depending on the intended use. P100 is intended to be used for one diaper. It detects through the clothing less than 4 millimeters in thickness. P200 is intended to be used for inner and outer diapers. It detects through clothing and outer diaper within 5 to 10 millimeters in thickness. Improper use. Use the detector only for the intended purpose to check if the diaper is wet or dry. Its LED light does not mean anything unless used for wet diaper detection. Keep the sensor away from hands or other substances. Battery replacement and strap usage. If the detector is used 24 times a day, it lasts 18 months and more without the replacement of the battery. Necklace chains in the strap make it easy to carry. For more information, visit our website www.paroos.co.kr or search urine detector on the internet.